This video is going to explore some postnatal information and wellbeing for mum, for baby and for the family. So first of all, I'm going to talk to you about the blood loss that you'll have after the baby's born. So regardless of how you deliver, a pool birth, vaginal birth, forceps or cesarean, you'll have a blood loss for around 2 to 3 weeks after your baby's born. This blood loss is coming from where the placenta has left a wound inside, and that wound then has to heal. So you're going to need to have some sanitary towels. So some thick, cheap, chunky sanitary towels, probably the kind you'd never dream of wearing on your period because they're quite thick and bulky. But those are the sanitary towels that you need to manage the blood loss after baby's born. You shouldn't be changing these sanitary pads more than every hour. If you're soaking through a pad in less than an hour, then you need to let a midwife or a healthcare professional know so we can come and do some checks on you. To hold those pads in place, you're going to want some big pants, okay? So leave your skimpy G-strings at home, they're not going to hold a big, thick, cheap, chunky pad in. So reach through your knicker drawer, grab some big old pants if you've got them, otherwise go to the supermarket and just get some packs of big pants. Disposable pants, it doesn't seem to matter if it's a size 8 or an 18, they seem to come with the exact same size elastic in, and they're not very easy to get on and they're not very comfy to wear. So a couple of packs of big pants that are nice and comfy. If you did have a cesarean, remember you're going to have a 10 centimetre incision just on your bikini line. So if you've got some little pants that just sit there, then that might be quite uncomfy. So big pants that you could almost pull right up and over what's left of your bump and tuck into your bra almost are the way to go, to be comfortable and to hold these pads in. Whilst you've got a blood loss, it's really important that we don't increase your infection risk. To avoid intercourse, to avoid using tampons and to avoid swimming, it's okay to bath with a blood loss. The blood loss will settle, and as you're coming to 2 to 3 weeks and the blood loss has settled or stopped for a couple of days, you can take that as a signal that your body has healed. And at that point it would be safe to resume intercourse and to use swimming pools again. This takes me really nicely into the use of contraception. So we do see ladies that come back to see us within a year who perhaps hadn't intended to come back within a year, okay? Having just had a baby doesn't mean that you can't fall pregnant straight again. Potentially you could ovulate 21 to 28 days after having a baby, have intercourse, fall pregnant, not have a period, think you can't get pregnant, but actually you could be pregnant already. So please do come back and see us, okay? We're keen for you to come back and add to your family, but it might be that you want to wait a year or two before you have another baby. And as I've said, we do see ladies back within the year who perhaps hadn't planned on that. Resuming intercourse is a really personal discussion for you to have with your partner, and it's about having that communication of understanding each other about when you feel ready to have that physical side of your relationship again. We will ask you to see your GP at 6 weeks for a postnatal check. Maybe at that point you feel more ready to think about contraception. If you want to have intercourse before 6 weeks, once your bleeding's settled, then maybe just use something like a barrier method like condoms if you don't want to get pregnant again. If you're breastfeeding, you can use all forms of contraception apart from the combined pill. So maybe speak to your GP at 6 weeks about that. Carer's stitches, so stitches that you may have in the perineum, the area between the vagina and the back passage. Really important to keep them nice and clean and dry. So to shower the area probably twice a day, change your pad nice and regularly so you've got a nice dry pad and you've not got a soggy pad sat against the stitches. Really important for good hydration and nutrition, plenty of fibre in your diet. Many ladies worry about having the first poo after having stitches into the perineum. I promise you the anticipation of going is much worse than the actual going. So as soon as you feel like you need to have a poo, then have a go, and it's not going to cause damage or pull stitches out. If you think you are getting a little bit constipated, then to get some advice about whether you need to have some medication to help soften your stool and to make it easier to pass. If you have stitches, they're dissolvable. Stitches for cesarean are also dissolvable, and the dressing tends to stay on for around 48 to 72 hours, and then it comes off and those stitches dissolve. It's It's really important as well to do pelvic floor exercises, and I'm going to talk about that in a separate video. Having a baby can increase your risk of blood clots during pregnancy, so your midwife will do a increased risk of blood clots. She may recalculate that risk after your baby's born and inform you that however you've delivered has maybe slightly increased your risk. She may ask you to wear some anti-embolic stockings, and this helps to reduce the risk by pushing the fluid back up from your legs. Tinzaparin is an injection that you may need to have to help reduce the risk of blood clot. It's a very small injection, if you look at the size of that compared to my finger, and it just goes into the fatty layer under the skin. Typically, tinzaparin is given once a day for a period of 10 days, and it's likely that you're not going to be in hospital for that period, so we need to show you or your partner how to give it. The risk of blood clot actually lasts for 6 weeks after the baby's born, so look out for signs and symptoms. Signs and symptoms in the lower limbs are pain, swelling and redness, and tend to affect just one side rather than both. Signs and symptoms in your chest are chest pain, difficulty in breathing, feeling that your breathing is more rapid or causing you pain. Any signs and symptoms of blood clots, then to get some medical attention urgently. Postnatal notes. So the purple booklets are the postnatal version of your green antenatal booklets. You'll get them after your baby's born. They come home with you, a pale one for baby, a darker one for mum, full of really useful information about what's normal, what to expect, and then maybe what's not normal and requires some advice. So do take the opportunity to read through these purple booklets and to absorb all that information. At the point your midwife discharges you, typically around 10 to 14 days, these come back to hospital and are filed in your notes. So do take the opportunity to read the information in there. Red Book. The Red Book is your baby's child health record from birth to 5. All their developmental checks, heights, weights, vaccinations go in here. If you have an LS postcode, if you can get one of these for your hospital bag from your GP surgery or your health visitor by 37 weeks. If you don't have an LS postcode, you'll just get one of these after your baby's born. Your baby will be offered hearing screening whilst you're in hospital. If you have a home birth or you go home before this is offered, you will get an appointment to bring your baby back for audiology checks. You might have got a booklet called Screening and Tests for Your Baby at the beginning of your pregnancy. This is on page 40 to 41 in there, and it explains why we offer hearing screening. If we detect a problem with hearing, then the sooner we know about it, the better, and we can put measures in place to improve quality of life and outcomes for that baby. So hearing screen will be offered to all newborns. It might be that the first screen doesn't come back with a clear response. It doesn't necessarily mean that there's a problem with your baby's hearing. It might be that it's been done too soon after birth and your baby's still got a little bit of fluid in their ears, which has affected the results. And you'll be either retested on the ward or brought back for that test doing at a later date. Your baby will be offered something called a Nippy Check. So the Nippy Check is a top-to-toe check done by the paediatrician or a midwife that's trained in this extended skill within the first 72 hours of birth, where we take a really thorough family history and we do a much more thorough check than is done at birth, where we look in the baby's eyes and test the hips and see whether we need to offer your baby any additional screening or vaccination. If this is done in hospital, then that's fine. If you have a home birth, then some of our community midwives are trained in doing this and could do this for you at home. Or it may be that you need to bring your baby into hospital for this doing within 72 hours. On day 5, the midwife will come to visit you at home and will offer you something called the blood spot test or the heel prick test. This is a test that screens for things like cystic fibrosis, sickle cell anemia, thalassemia, and lots of rare and metabolic conditions that aren't curable, but if we know about them, we can make changes to the baby's lifestyle. We take some samples of blood and pop them on these 4 sticky spots on here. That gets sent off and you will get the results back typically within 2 to 3 weeks. If they did come up with a positive screen, then a healthcare professional would get in touch with you sooner. Body image. We all see the magazines as we go to the supermarket, celebrities looking glamorous, amazing on the magazines. I had my baby 2 weeks ago and look at me, I look so beautiful and glamorous and my baby's sleeping through the night. Well, that's brilliant, but that's probably not reality. Reality is, just as your body's taken 9 months to grow and develop your baby, it might take 9 to 12 months to settle back. Reality is that you'll have good days where you get out and about easily, and then you'll have other days where your baby might seem unsettled, want to be held and snuggled a lot, and actually you're still in your dressing gown by 3 p.m. This is really, really normal with parenting. What matters is looking after yourself, meeting your baby's basic needs, and remember that your body can take some time to adjust afterwards. Exercise-wise, listen to your body. If you're doing something and it's comfy, that's great. And exercise is great for your physical and your mental well-being. To avoid swimming until your blood loss is settled. If you're doing something and it's pulling, it's tugging, it doesn't feel right, listen to your body. Try something a little bit easier, a bit lighter, and then come back and visit that exercise later on. Friends and family test is something you'll be asked to fill in at the point of discharge. Tell us what we've done well, tell us what we can do better. This is anonymous, you don't have to put your name on it, and it just feeds back into making improvements to maternity care at Harrogate, so have a look at that. Breastfeeding, sometimes babies are a little bit sleepy in that first 24-48 hours, and if baby isn't waking spontaneously to feed, the midwife will show you how to hand express the milk from your breast and to collect it in a little feeding syringe. Often when we give the baby a little bit of syringe express milk, they kind of waken up and think, oh, this is great, where do I get this from? And they become a lot more alert, and then skin to skin find the breast, latch and feed well. But this just means that we're stimulating your body's production of milk and we're not delaying this process any further.